You know, your heart beats about 100,000 times a day. It's this incredible, life sustaining rhythm, a perfect electrical symphony playing inside your chest. But what happens when that symphony goes completely wrong? Well, that perfect rhythm can suddenly become chaotic, totally unpredictable, and sometimes even life threatening. When your heart's ability to pump blood gets compromised, everything is at risk. So, how do medical teams listen in on this electrical chaos? And maybe more importantly, how do they fix it? So, in the next few minutes, we're going to do just that. We're going to trace the journey from diagnosis, actually listening to the heart's electrical signals, all the way to the pretty dramatic interventions that can shock it right back into rhythm. All right, so our number one detective in this whole investigation is a tool I'm sure you've heard of, the electrocardiogram, or as most people call it, the ECG. It is absolutely the frontline instrument for figuring out what the heart is doing electrically. So, what is it, really? Well, an ECG machine isn't listening for sound, like a stethoscope. Nope. It's listening for electricity. By putting electrodes on the skin, it can pick up those tiny electrical impulses that make the heart muscle contract, and then it translates them into that familiar squiggly line we all see on hospital monitors. So, what can this little electrical signature tell us? Oh, a ton. It's absolutely crucial for diagnosing those irregular heartbeats we call dysrhythmias. It can also spot the telltale signs of a heart attack, see if the chambers of the heart are getting too big, and even keep an eye on how medications or electrolyte levels are affecting things. It's just a powerful, non-invasive window right into the heart. And getting one done, it's actually pretty straightforward. The patient just lies down, their skin gets a quick clean to make sure the electrodes get a really good, clear signal, and then those little sticky pads are attached to specific spots on the chest and limbs. After that, the machine does all the work. Okay, so we've got the signal, now what? What are the medical teams actually looking for in all those squiggly lines? Well, they're decoding the rhythm, and they're searching for clues. A healthy heart produces a very recognizable pattern. Think of it like a perfect, steady drumbeat. Every peak and every valley you see on that ECG strip is expected. It's consistent, and it's evenly spaced. That predictable pattern tells us that the heart's electrical system is firing in perfect sequence. But then you see something like this. This is atrial fibrillation, or AFib for short. Instead of that steady, coordinated beat, the atria, the heart's upper chambers, are just quivering. They're quivering chaotically. The electrical signals are a total mess, and the rhythm becomes completely irregular. Just look at this side by side. It makes the difference so clear, right? On the left, you've got that normal, regular rhythm with a clear P wave. That's that first little bump that signals the atria contracting. But on the right, in AFib, the whole thing is erratic, the heart rate is all over the place, and those nice P waves, they're gone, just replaced by this chaotic, squiggly baseline. It's literally the visual difference between order and chaos. So this chaos, it has a name. When the heart's electrical system goes haywire like this, it results in a condition that needs a formal diagnosis. That medical term is dysrhythmia, and it's really a catch-all term for any kind of disturbance in your heartbeat. It could mean the beat's too fast, or maybe too slow, or, like we just saw with AFib, completely irregular. The problem can really start in a bunch of different places along the heart's electrical pathway. So why is this so dangerous? I mean, what's the big deal? Well, a chaotic heart is a really, really bad pump. This quote says it all. When the heart can't pump blood effectively, that oxygen-rich blood isn't getting where it needs to go, not to your brain, not to your organs, not to your tissues. And that's exactly when a dysrhythmia becomes truly life-threatening. Okay, so when things get dangerously out of whack, how do you force a reset? Well, this brings us to two incredibly powerful electrical interventions, cardioversion and defibrillation. All right, first up is something called cardioversion. You can think of this as a precision strike. It's a controlled, synchronized shock that's delivered at a very specific moment in the heart cycle, right on the QRS complex, which is that main spike you see on the ECG. Now, the key here, and this is important, is that it's used for patients who have an abnormal rhythm but still have a pulse. Now, defibrillation, that's the big red button. It's a totally unsynchronized, much more powerful shock that's used only in the most dire emergencies, like when the heart is just quivering uselessly, which is called ventricular fibrillation, or when there's a lethal rhythm with no pulse at all. The whole goal is to just stop all electrical activity, basically hoping that the heart's own natural pacemaker will wake up and restart a normal beat. This table really lays it all out, nice and simple.
Cardioversion is synchronized. It's often scheduled or elective for rhythms like AFib. Defibrillation is unsynchronized, and it's for emergencies only, for cardiac arrest. It's really the difference between a scheduled reboot versus a full-on emergency system shutdown and restart.
But, and this is a big but, these powerful procedures don't come without risks. With cardioversion for something like AFib, tiny blood clots can actually form in those quivering heart chambers. The shock itself can knock one of those clots loose, sending it to the lungs, the brain, or another organ, which could cause a stroke or a heart attack. This is exactly why patients often need to be on blood thinners for weeks before the procedure.
So when you think about it, it's pretty incredible, right? We can listen in on this electrical chaos with an ECG, and we can literally use a jolt of electricity to shock a heart back into order. It's a truly amazing medical feat. But it leaves us with an even bigger question. A shock can fix the rhythm in a moment of crisis, sure, but the real challenge is managing everything else to make sure that heart's electrical symphony keeps playing in perfect tune for a lifetime.